It's another webinar. We are so happy that we have Dr. Makar here. He was basically being an amazing support and help developing many techniques with Plexr. And also, thank you for joining us, all of you guys. I hope that this webinar become one of the best webinars. You learn a lot, you get lots of new techniques, and yep, Dr. Makar, stage
Thank you
yours.
so much for introduction. Thank you, everyone, for attending with us. Uh, I am glad to have this opportunity to could share my, my knowledge or my information, my experience with the Plexr technique. I've been, as most of you guys from Empire, yeah, probably seen most recently 2 days ago. Uh, Please, if you have any question, as always, I like to basically, tell what I know in the science part and the clinical component and the real world part. Uh, I would like also to introduce that I have a Plexr for about now almost 2 years now, more or less. Today we'll be talking about Plexr in and out, the science behind it, how we use it, how I'm using it, how the result I'm getting it done. So initially, I don't speak for aesthetic product in general, machines and everything, although I've been approached by several um, vendor and so forth, but I only machine I spoke to, which I really believe true with Cutera. All my machine, pretty much Cutera, except a couple of machines in my office, different approach. When I saw the machine here and Raj approached us, or me, myself, and I start to work on the machine and see a result, and that's why I was able today to come in and talk about the machine. So let's dive in. So hopefully by the end of the session today, we'll learn about the Plexr and how it works, what area of the body, and of course, what does mean to you and to your practice or adding a feature to your practice. Again, Dr. Makar, I originally board certified in family medicine in 2003, followed by a geriatrics fellowship, then another hospice and palliative medicine, then addiction medicine. Then I did finally decided to do aesthetic medicine in 2009. It's all within 4 to 5 years. I found that just doing medicine is not the way I really am dreaming. Guys, about HMOs, Medicare, and ACOs, and so forth. So by 2014, I went to liposuction, fat transfer, and by the pandemic came in, I tried to eliminate. I was doing like almost 7 days a week, and became very much non-invasive. In my office, I do only autologous fat transfer, submental fat. Other than that, it's just mainly resurfacing and so forth. So we're talking about the Plexr, and this is the how can I? Okay, so now, so the Plexr in general is just the different one makes it different from other devices. First of all, it's pretty much a very minimal and invasive. Patient can tolerate it just with the local. Patient could leave the practice with no significant damage, and the results is you could see it as early as a week and could last for a couple of years. Uh, this is the only thing I could emphasize what makes different how to use it and why I start to be convinced by using Plexr in most of my procedure now, because I didn't know the nature of how it works. Although I did have my what we call plasma pen back then in 2015, was just a simple device with the tip of like a needle, a real needle. Even the trainer said you could buy a Chinese needle and you could replace it. It was really was not happy with the result. So the word plasma in general, if you understand this concept, it will make a lot of sense afterwards. Because I could speak about the energy or device all day and I could show you a picture like all the reps do, but that's not my goal here. Plasma is defined in two different aspects. If you talk in a chemistry, chemical wise, we know all the plasma. Plasma is the liquid of the blood, contains 60% water-like, and that's what all everybody think. I'm creating plasma. I'm creating a gel under the skin, and the word plasma actually it means bigger than a liquid. Now, in the physics side, plasma is a different state of a matter. So the matters, as we know three of them. We know matter could be a solid, like a candle. If you put it under the heat, will melt, become liquid. If you continue to heat, will start to evaporate like water, it becomes a cloud and so forth. This is the three matters we know. But actually, there is a fourth type of matter that's we are not really know much about it, but we still to find out. It's called plasma. So when talk to the patient plasma, patients don't think the plasma is a PRP or something in the skin. So plasma is a gas, a form like a gas, but this gas becomes ionized and converted into different type of matter. For example, if you see the lightning before the thunder, this lightning, what do you call it? It's not a light, it's not a heat, it's not a sun, it's a plasma. So basically, the universe alone, the whole universe, I'm talking about starting from the sun, all to the earth, the universe, 90 to 99% made of plasma. The earth where we live in, very rare to find a plasma because we don't have, that's why we don't know about it much. So how this is convert or how we make this, if I take this, any sort of gas, put it under treatment with a high pressure, high temperature, I could convert this gas molecule to a different type of state. We call it plasma. To make it more, specific with people, with like physics, which I like physics. If you look at any atom, so any atoms made of nucleus and surrounded by electron. The nucleus made of two things, made of proton, which is positive charge, married with a neutron, which is no charge, but around the area, all around the nucleus, it's all electron. Electron is a negative charge. That what makes the cells is pretty much is neutral side. So what happened is when you put this cell or atom, so when you put this atom, the state of gas, under different treatment with, as I said, electromagnetic field or pressure or heated those atoms, this cell, think of it, the wall will open and will release this electron. The electron is at least thousand times number of proton in the nucleus. So that means the cell became pretty much same number of proton, equal number now to the electron. So I changed the nature of this cell or atom. So now once I get this, it becomes positively charged. And now when I release it from this, uh, handheld machine, away from the skin, away from any fluid nature, body fluid, it will does one thing, will attract the negative charge nitrogen cells or atoms from the air. As we know, the air is, or the one we breathe, 80% is nitrogen. Typically, scientifically to speak, is 78% nitrogen, 22 or 21 oxygen, and 1% helium. So when I release the handheld, this one, I continue uh, the the pressure or the power, the energy through the handle. Once ionize the air around the skin, convert into positive ionized charge, will attract nitrogen, which is negative. This one will convert the plasma energy. So again, you don't need to think about everything, but what I want you to think how this device works. Different energy, different way. I'm not going to call it energy because I'm just changing something into a different matter. If you look at the laser, the highest we can go 300 centigrade because it penetrates the skin. This one I could create, in the other hand, 20,000, but that makes it safe is I do not penetrate the skin, which means I do not cause damage to the skin. I only point to the area where I want to do. So this one I really want to emphasize because it was, to me, it was buggle and I couldn't really try to figure it out what it is. If you have any question, definitely you could ask because this is based on whatever I could show you a picture, you get impressed, but this is the nature of the power I use. So basically, as you see here, this is the handheld. Once I press this button, it will conduct an energy to this tip of the handheld and create the gas around. It becomes ionized gas. The ionized gas is positively charged, will attract or trap all the nitrogen particle around it and form this kind of energy, plasma uh, change in the nature of the gas. It's like almost thunder-like. But if you look at it, the tip of this, it should not touch the skin. And we're gonna go to next of few slides. We'll see when to touch the skin, when you not want to touch the skin. So basically the whole idea with the PPP, pulse powered plasma, it's a pulsatile type, very high power and a plasma energy. If I want to move nodule or I want to move object from the skin, which is I'll show you one of my patients, basically I want to ablate, I want to ablate the skin. So basically in science of physics, the volume of ablation to anything is divided on the volume of necrotic tissue, which one I'm going to damage. The more you go, the more you create necrotic tissues, plus the volume of the thermal damage, which is I'm going to create by the heat. So the lighter or the better this one number, the safer it is. So if I'm able to be more superficial, more lighter, more away from the tissues, the more preservative the tissues and the more preventing further damage and healing process of the skin. So basically, again, this is things for you to know. So when you think about this machine, why it's different from laser or any energy device? Because it works in any level by something called sublimation. Sublimation meaning it just, you're not converting anything to different state. Basically, if I use radiation or I use anything, I'm using something to convert it, vaporizing the tissue, like killing all this irritant. As a matter of fact, now I'm converting into a gas, which is gas effectively transform it into sublimation, which taking it slowly and is still in the surface, no damage. So if I want to put heat, so again, when you in yourself in general, when you buy any energy device, when I interview or when I'm thinking to buy energy device, the first thing I ask, what energy do you use? So all the laser world, L stands for light. So that's mean anything laser start with light. The word L, that's mean that they use a light. So the light has a very high power. convert into concentrate into beam. Beam becomes very pinpoint, then becomes heat and light energy. If I want to have, let's say, radio frequency, I use radio frequency microneedle. What I do with this one, I'm not using light, but I'm using the two polar frequency. They go from negative to positive all around the tissues and they create the energy. If I want to use ultrasound, something like all therapy, for example, I'm using the power of sound. So now I could use anything has energy introduced to the body. Almost always expect this gonna have subsequent either skin damage or skin prolonged healing or skin very slow results you will get. So now using a device, not an energy device at all. It's just a switching matter into different away from the tissue to create what I need to be done. So again, it's FDA cleared, which is all laser are. So everybody says FDA approved, not cleared, but all the laser is cleared to work in the United States. Not all of them, but most of them, if they get the best FDA, they call it FDA cleared.
Can I interrupt for a second?
Yes, please.
So the difference, many people ask, what's the difference between FDA approval and FDA clearance? So the answer is when you have an idea which was never tested before, then you have to go for a process and you're going to get FDA approval. When you have an idea which was, there is a similar technology before, which was FDA approved or cleared, then when you go to FDA, they say, okay, you need to file 510(k). And 510(k) means you say, hey, this is the technology A and this is technology B. Technology B is similar to technology A, but it is safer. So that's how it goes. That's why all the medical equipments, everything, they go through 510(k), which it's going to be FDA clearance. If you have FDA approval or FDA clearance, doesn't mean which one is better. They are the same thing, basically.
I see. Thank you, John.
Absolutely.
So basically now there's a three type of modality you can use with this laser, with this machine. First thing, nano or non-ablative plasma power. I call it non-ablative to my patient, and you will see when you could use it to your patient. The second one, halfway, which is semi-ablative plasma power. Again, the third one, you could use completely ablative. So the difference is how deep, how superficial, and how much you take in or what your plan from the skin. For example, this one, this is a triangle tip. This triangle tip, as we see here in the video, is touching the skin. So as we learned from before, that's mean if it touches the skin, I'm not grabbing too much nitrogen. I'm not grabbing too much plasma or changing of the gas surrounding. All what I do is very, very, you could see with the millimeter distance from the skin can create this enough power with this plasma, which should create millions of nano channels to the skin. It works or do as two things. Number one, the skin, our surface, it has a lot of deposit of the tissues. We have so much of epidermal thickening. We have so much keratinization of the skin. Those tissues, once you remove it, you're able to get, number one, a better look appearance. Number two, you're creating a many inflammatory process. Once you create those many inflammatory process, you're bringing tons of fibroblasts. Fibroblasts, it could then continue to grow into elastic tissues and collagen and hyaluronic acid, which is improve the tissue. On top of that, once you create those nano channels, I add sometimes in my office exosomes or uh, acto reverse to stimulate. This technique, I give it a name in my office for a patient who they're having a party or wedding, or call it bride or wedding package for both male and female, and to get this non-ablative. The patient could leave the office, and at the same time they feel the tightness, lightening of the skin, and I will do 1 ml exosome, and I tell the patient, I give him sometimes 1 ml to go home with, or sometimes you could use it as a passive income, give the patient with it hyaluronic acid or serum or brightening and so forth. This one here, as you see, after 3 treatment for the face, this one was a different treatment, got cat scratch, but the face around it here, you could see the texture, you could see the marionette area, you could see the chin, you get it like we call it orange peel skin. This one completely after 3 treatment, completely improved. Even you could see around the area, the lips get plumped by itself. Again, as I don't promise the patient the lips is going to get better, but once you tight the skin, because as we know, by aging process, the distance from the bottom of the columellar to the philtrum prolonged, if you shrink it, the lips will flip. The next picture, even better results. This one, it's a,
2 sessions.
sorry?
This is 2 sessions.
Yes, this is from treatment with, again, with using the Plexr shower plus many Botox. So many Botox, we use it and we teach it in the class several times. Once you release the muscles here enough, I could shower with all the face with many neurotoxins. Of course, this one, a neurotoxin. And also I tell the patient sometimes the procedure with the Plexr shower, eventually you use less amount of neurotoxins and filler gradually. The
Dr.
patient,
Makar, sorry to interrupt.
so,
So for this case, what we have done is Plexr glass lift. So with Plexr glass lift, we use the topical neurotoxin. It is not injected. So after Plexr shower, because the skin is open, it is receptive to anything. So instead of injecting Botox, what we do, we mix Botox with Acto Reverse, and then we apply it topically, and it will be absorbed. And that's the result that you see. There's no injection here.
great, thank you. All right, so the second mode of activity of the plasma in power is semi-ablative. So semi-ablative, as you see, number one is different tip. And the tip is like a needle-like appearance, but it's not sharp needle, it just has a very pointy tip. Number one. Number two, you're not very distant from the skin to create enough conversion into plasma, but yet you're moving horizontally or vertically, which is, I will show you a picture ahead with the patient. The more area you cover, the better results. So, for example, if you go to this picture, again, from that, if you go to horizontal and vertical, then from vertical, you go to diagonal, from right to left, and then diagonal again from left to right. Pretty much you cover all the tissues in between, the better results. As you see, it's very tolerable. Patient usually we numb some patients, we don't numb it. The difference also here, which Raj could help you in the training, which is initially I did in, the setting is different, of course, from any machine, is the machine, you could convert it into constant mode or continuous mode rather, or you bring it to fractional. So this one, if you see the light blinking, that's mean it's in a fractional mode. Fractional mode That's mean is like pulsatile type thing, and you could running from all the angles. And again, you don't see too much damage of the tissue. Downtime, I have my patient, I saw him yesterday. I did the procedure on him on Friday, and I could tell you about almost 90% or 80% improved, but 2 days. And I have a case lady, I asked her to send me her picture from home. I did under her eyes. Exactly in day 3, you almost see only very, very fine dots here and there. So with this one, again, the downtime is low, and again, creating same thing. We're trying as any procedure, we're trying to stimulate the tissue by, we do an energy, small injury or micro-inflammatory process. Once you inflame the tissues or any device by any energy or plasma touch the skin, the body will produce the interleukin 1 to 6, create the macrophages, and fibroblast come in, and angiogenesis start. Along with that, also you get all the growth factors coming around the area, and that's basically like almost the idea of PRP, but completely in a different application. And as we see here, this patient, same thing. This is cat scratching or cat resurfacing the face. And you could see now, the deeper you get or the more close to the skin, the better result, which is as any aesthetic procedure, the more aggressive, the more deeper, the more covering the whole surface, the better results. As we see, the skin damaging, the photo damaging from the sun, you could see the lightening of the color has brightening the skin. Again, the shape around it, the fine lines, it could even the nasolabial, the lapping lines start to improve. Again, with this procedure alone. So now this is the one I use it now in different approach, different cases, but the results is it's amazing. If you see here, this one is not in a human being, I believe, but this is a chicken wing, and the video will try to work it. So if you see how much shrinking you get with each dot, and if you look at how much tissue comes from above and below around the line. This is the idea. So you could use it, we call it the soft surgery. We're not using blade, we're not using any cutting or anything. So what we do here in this case, if you have nodule, you have sun damage, you have warts, or you have, I have a patient who had a keloid in her ear, and I will show you the picture. Most of those patients, the only way we do is we just surgically remove, or we give, let's say, 1 or 2 sutures, and you worry about scar, or patient develop keloid or any scarring. This one, what it does, same thing. Now, at this point, when it becomes ablative, we're gonna go back to where we start my physics analysis about how can I be distant from the tissues, yet the tissues has fluid, either on water and plasma, blood. And at this time, once I do this pulsatile power, this one will convert into the gas around it here into a plasma, which is attract the nitrogen and to create enough plasma here to could cauterize or this convert into this sublimation dose, nodule. And in the other side here, I could use it in a different way. I'm gonna bring all the tissues around, which is we call it, soft tissues in a different way. So for example, this patient, what we have here, Again, sign of aging, which I think I have a slide for sign of aging in the neck. Again, platysma start to shrink. Once the platysma start to shrink, the muscle go down, then you start to build a platysma band. Platysma band fold into inside out, and then you start to see the line when patient is saying E or trying to show their teeth. Once you have this, the skin start to become loose and you lose the subcutaneous tissues. When you lose it, then the skin start to contract because we have a smooth muscles in our dermis area. Basically, if I'm able to attack all the elevation of this area, not the downward, so the mountain, not the valley. If I'm above this one, what I'm gonna try to do is I'm gonna attract those down line in both sides and then we'll flattening the skin. And also, this is very aggressive skin, but you could use it in such a small, fine line. I could use it in all different skin quality. Um, Again, why are we using this technique? Of course, in general, you want to use, any patient asks you for how long. The first thing, anytime I do ablative or any something with any procedure, how long it takes to go away. And so the downtime is very amazing. In 2 to 3 days, when you go deeply ablative, maximum a week. So you're talking about surgery, which I'll show you on two patients I just have done last week. Uh, Surgical in less, what they in the room, they see results, yet in a week, you see complete result and continue to improve for the next 3 to 6 months. Natural looking, of course, the result is good, and you could use it in any Fitzpatrick skin. You could use it for multiple, from acne all the way to skin, turkey neck, upper eyelid, all over the body. And I have a patient, I did her lower extremity, and the satisfaction, of course, based on how you use, what you use, and what handle, and that's why it comes with the training. As I told you, I said I know about it. I know the plasma benefiting for him, but I start to know I have to go back and I get a good training and I start to use it. So basically, the skin aging, you want to reverse it. Again, we'll see in the top, you see the all muscles here with you get frowning line, you get glabella and frontalis muscles. The nose tend to get bigger pores and start to prolong. The tip will go down because the muscle gets stronger. Under the eye, you get a lot of wrinkles and orange peel skin, and even you get jaw. Believe it or not, I have a patient scheduled for a jaw treatment. I treat him with every single modality I have, even with the CO2, very high power ablative. It didn't work. I used the threads. I used 12 threads for him. I used horizontal, vertical, and lateral. I used 6, and I used for around the neck. The guy was kidding. He does a lot of shows in Chicago. And he said, I want to just cut it with a knife. And I called him once I saw the training that I can do the job, which is was very interesting. So with the face, again, as the lady we saw here with the glass left, again, with the mixing the exosome or acto or reverse with the neurotoxins, you could do it with non-ablative handle, or you could use both. You could put the soft surgery, reducing the reticulate with cat, resurfacing. The benefit, of course, of the technology, it just lasts long. You produce collagen, you defeat the purpose of aging, which is low collagen, low elasticity, and it's good for all skin type. This is my patient. This is 3 treatment. This is one of my office patient. 3 treatment only. Initially, when she came for consultation, she was talking about sun damaging and everything. And I asked the patient, can you smile? And when she smiled, I found this, I think, cut off the smoker lines and tons of lines here. I said, what about this line? I said, I think it's aging. Then we talk about, start to talk about, the process. And when she found us within a week and a couple treatment, 6 weeks apart, uh, patient was early March and has nothing to do with the sun because most of the laser were up in the summer. This is only 3 treatments. I wish I could see the smoker line she had here was completely gone. Only one here. It's just an amazing result. You could see it also lots of people 60 and above, mainly white skin, this horizontal line. And that's what most people end up by surgery with the plastic surgeon. Plastic surgeon, it just you go with a call it a V shape. You come from here all the way to the tip in the back, cut the extra skin and tighten it down, tug it, and the patient has a scar. It's a surgery, usually 12 to $20,000 now. This one, believe it or not, I wish I have the other picture. It's almost gone. Have only few wrinkle line here after 3 treatments. So she's planning to come back for after summer. Again, this is very interesting. This patient came into my office Wednesday, and here's showing just the cat resurfacing around the area here and around also um, the cross. But initially, I think I wish we have the picture first, the other one first. This lady, I'm gonna come back to this guy. This lady, which she took a picture from her home, if you could see closer, all the fine wrinkles in the eye, and that's basically in day 3 from her house. She sent me the picture, and I could tell you just if you see the much elevation here, how much tightening here. This is again, and the main reason was she was concerned about the bottom one, but I did just a few touch here. I wasn't really treating the upper. I was mainly what bothers her. The results, can tell by itself. This lady, again, this is right before she left my office. It's the same time. She's not 2, 3 days later. So this lady, when I said, I always tell the patient before I use the machine, that if you can see here, the skin, how skin is tightening here. And at the end of the procedure, I did it a courtesy. I took all the black dots here. You could see it here completely gone. So I could ablate any tissues I want to, which is everything here, and they could tighten. So this lady, I told her you need surgery. I can't even see your eyelashes. Again, you always be honest to the patient. You give alternative. You tell what you think, what you should. And the patient refused. She said, I have experience with my sister. They took one, now one eye bigger than the eye. She went back. The one went up smaller than the other. She almost become like a different alien. So when I told her about the machine, she agreed and we tried, and exactly 15 minutes. Well, what I did is just in the upper eyelid, I applied my BLT. I came back in half an hour. And while I was doing, if you see here, while I was doing one eye, still the BLT there, just the upper eye, and you can see it's very comfortable. Patient did not need any numbing or anything. And you could appreciate how much elevation her eyebrow is just right on the table. So this guy I was telling you about what I did, the CrossFit, everything, he started when he came to the office, same day, same thing, upper eyelid, doesn't want to do surgery. It wasn't that bad, but again, and I told him about the procedure, topical BLT, and you could appreciate the eyebrow here, see the eyelashes, and you could see this is elevation about 1 to 2 millimeter. By next week, I will say in 2 weeks, this guy will come back as exactly as a surgery done with no blade, no blood or anything. And I think I did, sorry. So once I finished with him, then we did cat resurfacing here with the same tip of the needle, the frowning here. You believe it or not, when he came Friday to pick up a serum I usually take, and this line is almost flat. Just again, I am not selling you, or I'm not telling you, I'm telling you my own patient, and I could have the patient, send you a picture. You could see the wrinkle here, one by one, it disappear. It's amazing. It just I know you don't see it in any laser, any energy device. It's just the nature of creating a new matter. This lady, same thing. I was able to take every single one here, converting into gas and with the energy device. Believe it or not, the same session and the same color, same everything. It just after I finished my procedure, I took my gloves off, of course, but from the same angle. This girl, same angle after the procedure, and I went slowly all around here, and this is where I have to take off the last piece. That's a keloid. Came in one more time and have to inject some steroid. Again, this patient also, I'm not sure if it's sun spot, but this patient also had what we call it sebaceous hyperplasia. I have to take it out. I have this patient also, she had a forehead like an old abscess or old tissues, and again, she doesn't want any surgery in her forehead. I took it out, and I think I wish I have the picture before and after. This one is very interesting. I want to save it till before this one from the forehead I took it. This patient, the next one, I'll tell you briefly before we see it because very interesting. This lady, she's 50. She said, I have this pimple for almost 10 years. I said, how you got it? She said, it was a white head, and I start to play with it, then it becomes inflamed, then dead tissue formed. And after the dead tissue formed, it's right there, it's so deep, and I don't want a surgery next to my face. And what I did is here, technically, if I do here, I will cut, and as you see how deep it is, I can get, and at that amount, how much I get from her inside her skin. So I had to show you how powerful this tip is. It's not ablative, it's not like multi, it's one point tip, and I was able to, once I reached that point, I was able with just a pressure from the bottom, I could get this amount. There's nothing or no device can create this in one pinpoint from the skin. And I wish I have the picture when she left the office. I have it in the other video, but not here. Patient left the office with almost nothing in her face. This guy also in his nose has multiple acne point. I ablate all this point from the skin, and I have a picture. All this white space, all this is pretty much gone. I have another. Okay, so for the neck, again, we saw before, as we see the aging of the neck, as we said, first thing or number one is just that the platysma. Platysma, we have subcutaneous tissue in the top and below. We lose the subcutaneous, the platysma muscles start to get thinner and becomes like a whole tendon, we call it bands, and becomes like, the turkey thigh. When you take a lot of like a bones coming out, too many spikes, that's the bands. It's a form between a tendon and cartilage. Once you get this one, the most problem happening here, now I need to create tissues, I need to stretch the skin, and now to form subcutaneous collagen fibroblast. That's exactly what I can deliver. And even the jawline, I could find the jawline. Why? Because I'm stretching below exactly the borderline of the jawline.
Dr.
I,
Makar,
yes, sir.
sorry to interrupt you. We are like we have 10 more minutes,
I,
but we can extend it to 20 minutes, but just be mindful of the time.
That's all. So the cat resurfacing, again, I could use both. I could use dots, or I could use, the cat resurfacing. Uh, I we see this patient earlier, but this is less intensive. Again, I could get rid of all the fine wrinkles. Lady, she came in expecting that we could do threads. Again, just a changing uh, approach, and we offer the patient the service. Those pictures are not mine. Those, I think there is a clinical study to get approval. You see the band with the fine line. You see the difference here. It just, again, it just does some result I have in my office. Um, so in general, for the neck, again, they did a study, part of the study, which is good to know. Richard Glago is one of the dermatologists. He came up with his own classification, 0 to 4. 0 means perfect. Makar, 19 years old. 1, mild wrinkle with minimum loss. 2 is moderate. 3, severe. 4 is advanced. So what happened is they took 10 females, all of them severe, and they treated them with, again, plasma, Plexr, and they added hyaluronic acid. And they did a 2 session, and again, for the study, about 90% went down from 3 to 2. Some of them went down to 1. I was not part of this study, just representing the slide. Again, in the bodies, which is very interesting. I've been using it in my patients, especially female with the stretch marks. It works great. The CO2, it does work in my office, but sometimes patient cannot tolerate when I go higher energy. But with this one, I found just a simple topical BLT. Patient can take it. The stretch marks, of course, and some discoloration, I could use it for contouring. Um, I don't have result yet for it to shrink some tissues around, but it does for the laxity. I have a patient has a laxity line here. I was able to correct it. I have a patient with the C-section. I was able to correct it. Patient with the tummy tuck. I was able to correct the keloid from it. And I have this, my patient, very happy, and she is very happy. What I did here, I did 3 treatments here. And then when the patient saw the skin much better, but the spacing up here, she built some volume. But what I did here, I did 2 treatment for radius. I did radius hyperdilute, and I used, along with this, I used monofilament uh, threads. So this is total, the whole thing here within 6 months, but you can see it's like transformed. She was coming, and she said I was never been, and she's again, she's almost late 60, almost 70, kind of, she has, nice wealth, and she goes to, sunny isles in Florida. She cannot wear the bikini, but now it's amazing if you can do around the sea. They call it the creepy skin. It's really it's a great result if you know how to use it and if you use it the right way. Again, this is the financial component, and maybe Rush can talk more about it. In general, you want to know how much I'm going to spend in the machine and how much this machine I'm going to utilize it. I'm going to add it into my practice. So your ROI, you have to figure out your community you live in. But the main thing I could tell you from my own experience, I have more than 12 laser in one office and have about 8 in the other office. I spend almost, I always fight, again, so one machine is about 325,000. Honestly, I bought one. It's called Enlightening. Has a triple wave Kitera for the, a couple issues. You could things use, but how much I didn't even get 1/4 what I paid for it. But I mean, you have to calculate. And with this, such a versatile use from stretch marks to face, surgical blepharoplasty, $5,000 in 15 minutes or half an hour. Facelift, neck. This lady, she paid enough, to be honest with you, the one with the thighs, close to almost 15,000. But she is so happy and she wants to add more next time when she comes, which is again, it's not nothing wrong. But you do this patient retention, of course. Patient comes from Florida to get treated. And again, you want to be in the edge with competing with other people. You don't want somebody comes to your cross street person because he has non-surgical facelift or whatever they call a wedding, cleanup or face, whatever. You could do the décolleté. Again, I wish I could, everyone could make this number, but again, it's true numbers. I could tell you that this is actually in the low side, the cat resurfacing, the décolleté, the lip contouring. You could have a patient had surgery. She put silicone in her lips and now start to convert internally. She's now in the 60s. She came from Salvador. I was able to revert it with the machine because they needed surgery. Again, facelift. There is so many areas, so many things you can use, and patient now they go on the TikTok and they see things, they see the tip of this and the patient, let's say they come in my Instagram, they see the eyelid opening up and I want to do it. Now it's something, and we all had to go through. We have to spend to make. Again, you want to be competitive and you want to do, explore anything in the market. So at this point, I will leave and thanks for having 10 more minutes and we'll go for questions.
Thank you, Dr. Makar. It was amazing. We
Thank you.
learned a lot, and your before and after pictures are unbelievable, especially the one that you showed immediately after procedure, because we all know that right after procedure, there is a swelling and inflammation. So it's hard to get the lifting, but besides that inflammation, you had an amazing lifting on the upper eyelid, which is amazing.
Do you have any question here, Fallon? Or no?
We do. So our first question is, for the skin tightening, did you do a rock star first to build up the collagen, then a resurfacing twice, or did you do the ablative technique?
For which patient? The lady with the thighs or which one? Or just for the face?
I'm going to
for
say she's probably face, yeah.
Okay, so for the face, you could do two things, but this patient will do the rock star first. You do it for 30 minutes, then you apply the acto or reverse, and then patients start to build fibroblast, and then, or you could go directly if the patient willing to have a procedure with a 1 to 2 days downtime. So it's all about, it's a conversation you have with your patient, and you could have, so we'll tell the patient, best result, you could get it with, you're going to be downtime 5 to 7 days. You could get a good result with 3 days, and you could do without downtime if the patient left. But this patient, yes, with the Rockstar, 30 minutes, acto or reverse, and then after that with the cat scrap.
There's one point here with the technique that Dr. Makar basically applied in this case, which is using the nanoablative first, because as he said, you are basically activating your fibroblast cells. So some people, they have virgin skin, like they didn't use any kind of skincare products or they haven't received any skin treatments or any laser or any facial. So those people, they need you to activate their skin before you go to any semi-ablative or ablative procedure. So that's basically a new approach to skin treatments, which is also very aligned with the nature of the skin. And that's why you see this kind of good results from it. So we always also advise to start with the Plexr shower treatments, even It is a glass lift or rockstar treatment as the first session, as Dr. Makar basically explained.
Thanks.
Perfect.
Other
And we have
questions?
a follow-up question, Dr. Makar. Have you ever done the skin tightening on the arms? And if so, what treatments did you do and what order in which did you do them?
Yes. I did have two patients actually. The one I did in saggy skin in the medial aspect of the arm. Patient is 68 now, a male, lost weight. Of course, you lose weight and the muscle gets saggy from the inner. This patient directly, I was going directly to the ablative mode, and the patient had 3 treatments, and I will say about almost 50% tightening, and is coming for another treatment. He's away for the summer, but he's coming for another treatment. I used for another patient, again, aging process around the elbow. Sometimes it gets embarrassing. It's mainly for, female, wearing, t-shirt or anything, and male as well. Now I see all type of client. And although those patients I did in the past for them, I did the hyperdilute radius, and I did also threads lifting, but I did not, or they were not really satisfied enough because they still have a couple horizontal and like a orange peel skin in the center. I was able to do this one with the, believe it or not, the Plexr shower first, and after 2 treatments, I will say get improvement. I did the ablative one and also improved.
Perfect. And we have another question. Is the use of Zimmer beneficial during this procedure?
We use what?
The use of Zimmer?
Oh, okay. So again, I might, Raj, do you have any
Yes.
approach?
So you don't need to use Zimmer, but and it doesn't basically do anything bad for the procedure. What we apply is the cold compress right after treatment. So you can use your Zimmer for right after treatment. During the treatment, you don't want to do that. The reason is we have a smoke evacuator, which basically filters the air, sucks the smoke. You don't want to breathe that smoke, right? So if you use the Zimmer, you are basically spreading the smoke in your room, and it's not basically the right thing to do. But after procedure, when you are done, yeah, perfect. You can use your Zimmer to cool down the skin, and it's a good way to basically lower the inflammation also. The only thing that you shouldn't use after Plexr is you don't use any kind of corticosteroid after that, but cooling is fine.
Yeah, just yeah, the main thing is again, patient usually as in with inflammation, you could use, but honestly, I've been using the arnica gel sometimes in the top of it, or sometimes I use like the one we have. Which one you have here, Raj? It's called.
This is the vitamin C balm, which is basically designed for Plexr, and it has vitamin C, and it has 13 different essential oils.
Which one is it? Covers the dots and everything. It's called.
We have concealer, which
Yes,
is
concealer. Yeah,
cream.
concealer.
Yeah.
Actually, you could. I seal it after also the procedure separately. I tell the patient you could use it 3, 4 times. It has also, variety of masking the color, yet heal the skin and provide vitamin C. It's really good, actually. Patient love it.
Yeah, that's the best product for after Plexr or any laser microneedling either.
Alan?
Perfect. And our next question is, can you outline the protocol for thigh tightening?
Okay, so this one was again was very interesting with her. We did first the ablative mode. I did 3 treatments and 2 months apart because it was aggressive. And what I mean aggressive, I don't mean aggressive. I mean less than 1 second. It's about 1 second each dot, no matter what it is. And well, again, with the training you get, there's area you go with half a second, an area would go 1 second. Aggressive, I meant all the way from the groin area, all the way to below the knees. And the procedure, honestly, I charge $5,000 because to have all this area, and it was really a lot of work. And after we finish that, we continue with the topical vitamin C and hyaluronic acid pre-treatment 2 months apart. And after that, the skin it get tight enough, but less volume, so it looks like concave from in. So what we did is she did about first time 6 and 6 hyperdilute radius. I did all hyperdilute radius, stretching all the skin, and then all around the fine lines, I was able using 30 gauge and 20 gauge monofilament threads, and everything was charged separately. And this patient came in every treatment. For after the 3 treatment of this one, she gets another 3 treatment of the threads along with liquid, hyperdilute radius.
Perfect. And we have one more question. How do you treat or prevent PIH with this treatment?
Okay, so as a matter of fact, which is funny part is because you're not approaching the skin, the two modality of nano or non-ablative and CAT resurfacing, you're not creating any deep tissue inflammation enough to bring hyperemia and the skin to discoloration. As a matter of fact, the CAT resurfacing, it could help to improve the melasma itself. With this PIH, my recommendation, one thing, you need to know what tissues and what color. That's why I came up with 3 handles. It came with a white, green, and red. White, I use it with a patient I think they're gonna have PIH or patient has a history. I ask the patient all the time, show me your hand. Sometimes the cuts are especially female in the kitchen from cooking or anything. Sometimes if I see dark or a patient got cut or patient surgery dark, I use the white handle and I use half a second. So now I am minimize the power coming from the hand and minimize the exposure of the tissues. This is what I'm going ablative. Now I have to do ablative. So this is the way I minimize it. After we do that, again, we use the concealer, which is again as I think natural green tea, anti-inflammatory component, not a steroid, but it's something to lower the swelling. Again, in general, this is off topic because probably you guys know me. I always go off topic. Any patient you feel you're gonna do procedure and you feel like they're gonna have dark or you're afraid that they're gonna be PIH, usually after the treatment, the results occur and you feel like you get the results, I will tell the patient use 1% hydrocortisone cream like a month or 2 later. Supplies in the area once a day for 1 week. Usually takes enough it causes hypopigmentation enough not to cause any procedure. But mainly with the laser, I use it 2 weeks after. It helps me to take off the PIH results. But again, the color of the handle, the length of the exposure, half a second. I rather to do 20 dots with a half a second rather than to do 10 dots with 1 second. Although the same result, but the exposure will be less.
So that's exactly what you need to do. The best way to not to have PIH is to do it right, which is using the proper handpiece and then don't be aggressive. We made a clinical study for evaluating the PIH, and the risk of PIH with Plexr was just 2%. And those 2% without any treatment after 6 months, the PIH was gone. Now, as Dr. Makar was explaining, if you use the right handpiece, it's not going to be any problem. The other thing is with the CAD resurfacing technique, so far for the past basically 2 years 3 years basically that we have this technique, we had no PIH, and the results are amazing. So with a semi-ablative, for people who you are scared of, maybe they develop PIH or they're sensitive skin, then use basically the CAD resurfacing.